I'm Pedro Gomez from UT Health San Antonio, one of the PGY5s. Appreciate the opportunity from Sages to let me present in here. And I will be discussing the console gaming and virtual reality in surgical education. This is not going here. Oh, this one here. Perfect, thanks. Got it. Perfect. Unfortunately, no financial disclosures to share. I'm just someone who is very enthusiastic about technology. I will basically address only virtual reality or computer-based consoles, and this serves as an informative session for all of you that are here. On the bottom, video game industry has clearly changed back from the 80s when I was a child to what we have now. The basic console you see on the left, the first Nintendo is what they have now. Same thing has happened with our surgical simulators. Just in 10 years, you've seen on the left in 2007, very computerized virtual reality laparoscopic simulator, and then on the picture on your right, images that you can't barely realize if they're real patients or computer generated. So in San Antonio, what we end up doing is we wanted to see if there was any effect or any relationship between this kind of virtual reality video games and applications to consoles. So this was one of the first experiments we started doing back in 2012, 2013, when we had participants, residents, play with the Wii, and basically with a game called Marvel Mania, we tried to assess if the skills that they acquired were able to be transferred to either a physical model or a virtual reality model in the laparoscopic camera navigation sense. Interestingly, we saw with our results that video game performance correlated with their performance in the virtual reality platform, but not on the physical model, which was unfortunate for us because we wanted to show that these virtual reality skills could actually translate into clinical practice when one of the interns go and drives the camera for a lab collie and thus needs to avoid faculty getting mad by the shakiness of the laparoscopic camera navigation. But then a couple of years later, with improvement of the virtual reality platforms, actually I led this study for comparison of virtual reality platforms such as the GA Mentor versus a physical model such as the Kyoto. So we got 27 interns, basically a pre-test, training, post-test model type of research where we divided the training in 3 groups. 1 or 9 of the interns just training with the GA Mentor, other 9 with both platforms, and then another 9 with the Kyoto. Actually, Dr. Van Sickle was one of our faculty involved in the project, and by comparing their performance pre-test versus post-test, using the gauges as a tool to objectively identify their clinical performance, we saw that people or residents that trained in both the virtual reality platform by itself or combined had a significant or a statistically significant improvement in their clinical skills. So we thought at that point that virtual reality platforms could actually have a role in training of junior residents. We did something similar with robotic surgery, just with the virtual reality platform that all of you can find on the simulation package for the Da Vinci. And again, with assessment of 7 different robotic skills that we call basic robotic skills through a basic curriculum through pre-testing, training, and post-testing, we saw statistically significant improvement on each one of the skills for the junior, senior, and faculty that went through our protocol. I think it's key since it's basically one of the mandates from ACS to have a simulation center, and since there's quite a huge diversity of the different simulators that each one of your institution has, is to adapt and do some research on what you have, how can that be applied to your residents, and then, as we have done over the past 4 or 5 years, implement this into your specific training centers. A little bit of A little bit of further information is virtual reality platforms, as mentioned earlier, have been widely incorporated specifically by SAGES with the FES efforts. As most of you know, the virtual reality platform was chosen over the more economic option based on extensive research done by this institution. And I just want to end my presentation by showing some of the what I call my beta testing skills for the past 5 years. When I come to these meetings, I like to try different simulators, see what they have, without trying to endorse any specific company. I think Symbionics has done a great job at trying to develop high fidelity, procedure-specific simulators, such as this laparoscopic or lap mentor. When I tried version 1 4 years ago, was extremely basic. Graphs were not that great. When you put your instrument in, it was not adequate. And right now, their latest version, which is version 3, could be a great tool for procedures, maybe for PUI 1s and 2s that never done a lap call before, but at least they can experience or have an idea of how to perform a lap calling before going the first time to the OR. Same thing, wide array of robotic simulators. I think most of you are familiar with the skill simulator that you can get with your Da Vinci system. And Dr. Van Sickle showed the video on top, which until 3 years ago was very high-end technology, high fidelity, great for learning the basic robotic skills. But then most of you might not be familiar that you can add a second simulation package for free. The one on top is by Symbionics. The one on the bottom is by Mimic. And all you need is an enthusiastic resident that makes a few phone calls, has a computer, a thumb drive, and you can perfectly install these basic suturing skills, exercises on your machine, basically for free. So where is the future going into simulation? I was gladly surprised actually to try this specific simulator, which is the Robotics, again, developed by Symbionics. Very realistic or high fidelity. I think that goes beyond the resident training purposes. I think even as faculty, if you can clearly understand and do the steps of a robotic inguinal tap, like right here as they're developing the peritoneal flap, it's a great way to train. Actually, this simulator will guide you through the anatomy, where not to create your dissection. So I believe the future of this type of technologies is going into procedure-based or procedure individual techniques. To conclude, and on quoting my two mentors, Dr. Willis as well as Dr. Van Sickle, simulation has basically become the cornerstone of surgical education, at least nationwide here in the U.S. Multiple curricula have been established. They continue to appear, like every single meeting that I come to, adopted by multiple organizations, SAGES, by ACS. I think the future lies maybe on having more portable platforms, such as the GA Mentor Express, as well as this brand new robotic 30, 40,000 portable device, maybe having some virtual reality, immersive, high fidelity skills, and why not some role for surgical 3D printing and rehearsing interventions before actually performing a real case in a patient. And that was perfect timing. Thank you for your time.